Welcome to Module 4 of the OCAT Virtual Training Series, addressing secondary trauma and strengthening resiliency for staff. The virtual training series is designed for staff wanting to refresh their knowledge and skills, staff who are responsible for training or coaching others, and new OCAT staff. The training modules within the series are designed for individuals but can be used in a group setting by supervisors and trainers to strengthen case staff skills. Throughout the modules, you will be directed to resources and practice exercises intended to enhance the learning experience. This webinar will provide an overview of secondary trauma and explore strategies leadership and staff can implement to promote staff well-being and resilience. By learning how to strengthen staff resiliency, organizations can build their staff's capacity to regularly hear their customers' traumatic stories and to take measures to reduce secondary trauma among staff, while continuing to provide holistic case management. By the end of this webinar, we hope that you will be able to define secondary trauma and the connection to comprehensive appraisals and holistic case management, recognize common signs and symptoms of secondary trauma, identify strategies staff can implement for addressing their secondary trauma, understand leadership's role in helping staff address secondary trauma, and consider organizational strategies to reduce occurrence of secondary trauma among staff. Let's start with an overview of secondary trauma, as well as the signs and symptoms. Staff who regularly interact with customers are familiar with the various complex challenges customers navigate. Many of the families served by public assistance and other human service programs are currently or have recently faced situations of violence, trauma, societal injustices, and a variety of other stressful factors that can wear on their and on staff's mental and emotional well-being. The ongoing exposure to these difficult life circumstances takes a toll on staff and can hinder a staff's ability to respond to customers in a compassionate and supportive way. Before we proceed, let's review some key definitions. Secondary trauma, a term sometimes used interchangeably with vicarious trauma, is defined as the stress resulting from helping or wanting to help a person who is suffering or experiencing trauma that presents as a cluster of negative symptoms. It is the emotional strain that comes from exposure to a traumatized individual rather than from exposure to the trauma itself. It's important to note that secondary trauma can occur over time with chronic exposure or from a single incident. Relatedly, the term burnout refers to the cumulative process marked by emotional exhaustion and withdrawal associated with increased workload and institutional stress. It does not have to be trauma-related. There are typically 4 stages of burnout: enthusiasm, stagnation, frustration, and apathy. When burnout is combined with secondary trauma, the result can be compassion fatigue. Burnout and compassion fatigue share some commonalities, including physical, emotional, and mental exhaustion and a reduced sense of accomplishment or meaning in work. Those at greatest risk work with and/or assist children, adults, and/or families who are or have experienced trauma. Further, it is common with those who experience over-identification, those who are reminded of their own trauma, and those who experience high levels of empathy. Over-identification occurs when someone ascribes to oneself the qualities or characteristics of another person, the transference or reaction to one person with the feelings or responses relevant to another. Many staff are attracted to this type of work and are good at it because of their own trauma histories and resiliency. Unfortunately, some customer stories can serve as triggers or reminders of staff's own trauma. When we feel high levels of empathy, which may occur all of the time or more selectively, for instance, when we hear of vulnerable people, such as children affected by trauma, we can generate more personal distress. It is important to remember that many of those who work in helping professions, such as case staff, may have their own personal trauma histories, which may be exacerbated by working with others who have experienced trauma. Non-clinical staff may also have trauma histories, especially if the organization is located in a community that experiences high rates of adversity. This makes it all the more important to train staff on how to identify and work through secondary trauma when the signs start to appear. The potential effects of secondary trauma are extensive and can look different for different people. However, they often include intrusive thoughts, chronic fatigue, and sadness, anger, fearfulness, shame, poor concentration, second-guessing, and detachment, and emotional exhaustion, physical illness, and absenteeism. These effects not only negatively impact staff personally, but they can also negatively affect job performance. According to a study of over 1,100 child welfare staff, secondary trauma negatively impacted staff's professional satisfaction and efficacy, and had a direct effect on a staff's intent to leave their agency. When combined with an unsupportive or toxic organizational culture, the negative effects are further exacerbated. Let's pause a minute to think about some of the sources of stress in your life. What consistently causes you the most stress? Now, think about ways you can or do manage that stress. Consider strategies you can implement both at work and at home. We know that secondary trauma can be caused by exposure to customers experiencing trauma or distress, and it can negatively impact professionals' mental and physical health, safety, and well-being, as well as that of their families, the people they care for, and their employing organizations. We are now going to revisit some of the sensitive topics within OCAT where customers may share traumatic or distressing information about their lives. Then we are going to discuss some tips for handling those conversations so that you can work through secondary trauma at the personal, leadership, and organizational level. Take a moment to think about your interactions with customers. What topic areas or specific questions in the OCAT tool could potentially elicit traumatic or distressing information from the customer? It is our goal to understand a customer's circumstances to the best of our ability so that we can better assist them in removing potential barriers to long-term employment. However, this means we are faced with asking sensitive questions that may elicit information that we find traumatic or distressing ourselves. Let's walk through a few examples of areas in the OCAT tool that may be stressful or traumatic to discuss with customers. During the domestic abuse section, a customer may share distressing information about their intimate relationships or an abusive family environment. This can be particularly hard for us to hear, especially if children or other vulnerable populations are involved. For some of us, especially those who may have a history of substance use in our own families, hearing about customers' experiences related to substance use can be a reminder of our own trauma. Similarly, discussing matters of emotional and mental health can trigger secondary trauma. Staff may also have their own traumatic experiences with emotional and mental health disorders. When discussing any of these topic areas with our customers, it is important to be aware of our own needs and how these conversations might affect us. In the next section, we will discuss how to define the role of a case staff and how that may help you navigate any feelings of compassion fatigue or traumatic stress that arise as a result. Empathy is defined by Merriam-Webster as the action of understanding, being aware of, being sensitive to, and vicariously experiencing the feelings, thoughts, and experience of another, of either the past or present, without having the feelings, thoughts, and experiences fully communicated in an objectively explicit manner. But how can empathy be harmful? We have been taught that being empathetic is the best way to understand. However, there is a difference between being empathetic as we seek to understand our customers' circumstances in order to connect to them to appropriate services and resources, versus feeling as if we need to fix their situation or save them. Remember, The role of staff and frontline staff is to support customers in achieving their goals by providing guidance based on programmatic expertise and connecting customers to appropriate services and resources. In the event that you do find yourself exhibiting the signs of burnout and secondary trauma we discussed, here are some tips for managing them. You should find someone to talk to, which may mean seeking professional help, and always try to be patient with yourself. Understand that the pain you are feeling is normal. Make sure to practice good self-care and remember that self-care is not a one-size-fits-all solution. What works for your coworkers may not work for you. And finally, identify what is most important to you and focus on those things. On the other hand, don't blame others or make rash, impulsive decisions. Try not to work longer hours or try to compensate or push yourself out of a rut. And do not self-medicate. Most importantly, do not neglect your own needs. The next slide will discuss some ways to pay attention to your needs through self-care. Self-care means setting boundaries between your work and personal life. It is about taking action to restore balances between the two, not just as an add-on activity, but through development of self-awareness and self-regulation. Some strategies to help you implement self-care and find balance include honoring breaks and lunches. For some, this is easier said than done. Leave your desk at regular intervals, get a change of scenery, or have lunch in a different location, such as the cafeteria or a local park. Respect your own limits. This goes back to the idea of creating healthy habits. Tailor them to what rejuvenates you, whether it's better sleep, nutrition, exercise, or meditation. Use vacation. Sometimes it feels impossible to step away from work long enough for a vacation, but remember, it's good to get away to recharge. Find hobbies. Often, the most rejuvenating hobbies are those that are completely unrelated to the work that you do. Choose something challenging, fun, and different from your everyday activities. And seek help outside of the office from a professional who can provide objective support and guidance. Remember, you're in a unique position to help others on their journey to becoming more independent and self-sufficient. Be a role model for health, setting boundaries and limits, and finding balance and contentment in your life. Most importantly, we are all human. This means acknowledging when we need to take a step back and to take care of ourselves. Now, think about the environment at your own organization. Does it support you in managing your stress and building your resiliency? If so, how? Although staff can implement individual interventions to address their secondary trauma, there is typically little they can do by themselves to address the organizational culture that leads to burnout. Burnout is directly related to prolonged response to chronic emotional and interpersonal stress related to high demands, low rewards, increased workload, and organizational stress. When secondary trauma and burnout are combined, the result is compassion fatigue, referred to as a staff's reduced capacity or interest in being empathetic towards the customer. This can impair staff's ability to effectively help those seeking services. Given that burnout is related to organizational culture and compassion fatigue negatively impacts staff's ability to effectively serve customers, organizations will incur additional costs related to poorly managed secondary trauma and organizational culture. These compounding negative effects lead to low staff morale, higher turnover, creating additional costs to organizations related to the costs associated with recruiting, hiring, and training new staff. Additionally, when there are gaps in staffing due to turnover, existing staff suffer with heavier workloads. This may impact their own quality of work. So, how do we minimize the individual and organizational negative impacts of secondary trauma? The answer lies in building resiliency. Resilience in this context refers to the ability to maintain our physical, emotional, and mental well-being while responding compassionately to people who are suffering. Let's look at ways both individuals and organizations can build resiliency. The Children's Trauma Institute, CTI, through a partnership between the Administration for Children's Services office in New York City and the Mount Sinai School of Medicine, has identified resilience-focused interventions designed to decrease stress on the staff through enhancing resiliency skills and increasing social support. Let's walk through the three components of this model and discuss some examples of how you can implement them. Optimism. Although challenging at times, the more we can practice optimism and focus on the best possible outcome, the more we buffer secondary trauma. Affirmations, individual spiritual practices, peer support, and positive work environment can foster optimism. Collaboration. This intervention encourages mutual support between staff, supervisors, and customers together toward the best interest of the family. This is supported through customer-centered case management that incorporates comprehensive appraisal tools like OCAT and builds partnerships with customers through techniques such as coaching and motivational interviewing. Mastery of negative emotions. This work inevitably stirs negative emotions, so the better we can develop and execute skills, including self-care, to regulate our negative emotions in a healthy manner, the better we can prevent and manage secondary trauma. Therapy, peer support, meditation, massage, hobbies, quality time with family and friends, and exercise, amongst others, are all examples of ways we can develop or execute skills to regulate our negative emotions. There are a variety of things individuals and organizations can implement to minimize the negative effects of secondary trauma, reduce burnout, and avoid compassion fatigue. Every action towards building resiliency, regardless of how seemingly small, contributes to improved resiliency for the individual and for the organization. To build on the previous model, consider the following strategies for strengthening resilience, both at the organizational and individual levels. Set realistic expectations for yourself and others. Unclear, hidden, or unrealistic expectations that consistently go unmet drive compassion fatigue. Set boundaries for yourself. Know what you can and cannot take on, and try to find a balance between being over-involved and under-involved in the lives of your customers. Promote positive self-culture by connecting with colleagues, both formally and informally. Again, practice good self-care and model it for others. Let's talk a little more about organizational culture and steps organizations can take to be secondary trauma informed. These are the 5 strengths of a healthy secondary trauma informed organization, according to the Vicarious Trauma Organizational Readiness Guide, VT-Org for short. The guide, which is included with the recommended resources at the end of this training module, identifies strengths and gaps in each of these areas. It can be used to guide policies and programming to assist organizational efforts to become a healthier secondary trauma-informed environment. Let's walk through each of the 5 pillars. Leadership and mission. This must lead the way with clear communication to staff, and specifically in regards to the mission. Leadership should openly acknowledge the prevalence of secondary trauma and ways to address it. Managers and supervisors can provide quality supervision and support. This goes a long way in strengthening staff morale and productivity. Supervisors should model and promote self-care, be open and respectful with their communication, and institute other workplace values. Further, performance reviews and evaluations could include a discussion of secondary trauma. Employee empowerment and work environment. This can include respecting staff's differences, providing a sense of teamwork, and offering direction in managing conflict, as well as empowering employees to contribute to a positive work environment, such as by offering opportunities to provide input on program development and evaluation. Training and professional development encompasses everything from thorough onboarding or orientation to ongoing in-service trainings to encouragement and funding for external conferences. Staff health and wellness. This promotes and provides access to wellness activities and strengthens staff health and resilience. Having clear policies supporting physical and mental health and wellness, encouraging time off, and offering services such as employee assistance are all examples. Here are a few strategies for creating a supportive environment for staff. First, provide downtime. Consider giving each staff member the option to take time each week for themselves. Modify the environment. Make efforts to create more welcoming spaces for both staff and customers and find ways of reducing stress. Some staff may find it helpful to find spaces other than their own offices to meet with customers in order to create more privacy with fewer distractions. Additionally, consider taking staff off-site for meetings to give them a break from the office. Rotate challenging cases and diversifying job tasks. If someone feels particularly triggered by working with a particular customer, or if they have been working with a customer for a long time and feel like they are not making progress, it is okay to rotate these cases from time to time. This can ultimately be beneficial for both the customer and the staff member. Allow for flexible schedules. Consider offering flex work schedules and alternate scheduling, which may include working 4 10-hour days. For instance, this allows staff to have a 3-day weekend rather than a 2-day one. Or, with prior approval, and if it works for the organization as a whole, you may choose to allow staff to flex their hours from time to time to have a longer lunch break. Offer on-site classes, for instance, yoga, Pilates, and meditation. Some organizations promote health and wellness by arranging to have yoga or Pilates classes on-site. This could be a fun lunchtime activity for staff and an informal way for them to build connections with one another. If offering something on-site is not possible, encourage staff to seek out health and wellness activities outside of work, perhaps through a reward program. Organizations can better support their staff's mental and physical well-being through continuous training opportunities. Training in areas such as emotional intelligence and strengths-based case management can help staff manage their own stress and mitigate the impact of secondary trauma. Further, offering professional development tools and techniques can help reduce the daily cognitive workload that can contribute to burnout over time. It's also important to remember that organizational shifts have to start with leadership. If supervisors model a strengths-based approach and place a greater emphasis on their own self-care, their staff will too. Now we'll discuss key takeaways from the module, additional recommended exercises to strengthen what you've learned today, and recommended resources available through the OCAT Learning Center. As we conclude this training, please consider the following. Remember that the cumulative effects of exposure to customers' trauma can negatively impact staff's mood, motivation, quality of work, and physical and mental health. That means it is important for you to be able to recognize the signs of secondary trauma and take the appropriate steps for self-care. Remember, this starts with you. At the same time, leadership and organizational culture should also have strategies in place to support their staff's emotional and physical well-being and to build resiliency. We have discussed a number of ways organizations can do this in their work environments, including promoting personal health and wellness, providing professional development opportunities, and creating a culture of open communication. After completing this module, complete this recommended exercise. This exercise is intended to be done with a learning partner and can help you develop and implement new stress management techniques. Here are a list of recommended resources available in the OCAT Learning Center. In addition, the resources available through the OCAT Learning Center, we recommend checking out the following additional resources. Compassion fatigue. Coping with secondary traumatic stress disorder in those who treat the traumatized. Vicarious traumatization, a framework for understanding the psychological effects of working with victims. The Vicarious Trauma Toolkit, tools for you. context of best practices for addressing vicarious trauma, organizational prevention of vicarious trauma, and the supervisory guidelines for a vicarious trauma-informed organization. Thank you for taking this training. We hope it has been valuable to you and helped strengthen your interactions with customers.